We have a very challenging case. This is a 74-year-old woman who's actually much younger mentally and physiologically than her stated age, with significant multi-level degenerative disc disease, a degenerative scoliosis that is broad all the way through the lumbar spine. But here's the most important thing: on the lateral, there's an L4-5 spondy. Difficult to see if it moves because she also has osteoporosis, but you can see on the MRI that although these other levels look bad, really the main problem is at L4-5, where there's a spondy and very severe stenosis along with facet hypertrophy and facet fluid signs. So we talked about a variety of different treatment strategies, including a full-on reconstruction to try to fix the entire curve, as well as any coronal imbalance, despite the fact that she's fairly neutral overall. And because of that, we decided that we should utilize a focal treatment technique, minimal invasive surgery, and just treat 4-5 and treat all the other levels afterwards non-operatively, which would be one and the same as the post-operative rehabilitation for 4-5 post-op. We'll utilize the minimal invasive lateral technique with stage 2 posterior percutaneous instrumentation, and of course we'll use computer navigation to make things perfect and easy for me. Alrighty, we're about to get started. I have the incision made and I have the initial retractor down, and I'm looking right at the psoas muscle to make sure that there's no critical structures in the way. And now I'm down at the disc, and I want to position this initial dilator right at the 50-yard line. Oh, this thing is going to get massive. Just got to not get too greedy. This is getting really, really tall. Shot. Come on out. Okay, we're going to close the wound and start thinking about the posterior part.
How's it looking so far, Dr. Tim?
It looks absolutely perfect. If you look on the left lower hand corner, you can see the extent of the indirect decompression. The neuroforamen is just huge now, and the spondy is almost completely reduced. So in this setting, I don't want to go in there and muck anything up and cause a lot of bleeding. This is enough of a decompression indirectly. So I'm just going to lock this in and do good fusion. And yes,
let's wait just a second until he stops with the burr, and we'll put that on the shoulder.
This is a really good bite. Whatever osteoporosis you have, it's not in your back. Woo, that's a good bite.
How's the case go, Dr. Tim?
It went beautifully. I have a very large implant in. Your bone is much stronger than I thought. And I think you're going to feel like an inch taller. I can't wait for you to see the x-rays. And we're all hoping you get better real fast. So best wishes.